I hope everything is okay. So good evening everyone and welcome to the discussion of the MCQs so-called which were asked in the INICET exam. So I hope everything is okay. And as far as the pediatrics part is considered in the INICET exam, the questions, I hope they were straightforward questions and many of you are able to reply. And nowadays pediatrics has become really a high scoring subject if we go according to this. So if we go regarding the first question was based on the milestones. The child can tell story, go to toilet alone, copies cross, age of the child is, right? A straightforward question. Normally I say a 3 years old child. Now 3 years is the age when the child starts going to the school. Child goes to the school, teacher teaches him how we are going to get a zero. So child can draw a circle at the age of 3 years, 4 years. In this school, the child has been promoted from nursery to the KG class, so-called, just a way of remembrance. They both want to play together. One draw one line, another draw another line, so that becomes a cross. And 5 years, what we mean to say, the friend circle has further increased. Now there are 3 friends. All 3 want to play. One line, another line, another line. That becomes a triangle. This is just a way of remembrance. You can easily remember this, right? And child can understand a story. Child can understand a story, that is at the age of 2 years. 2 years. But child can tell story, poem or song, that is at the age of 4 years. 4 years. Right, so Nishant, I hope here the right answer will be the question, the choice C, that is the 4 years. Always remember, don't make the stories in front of a child if the child is less than 2 years. He will not be able to understand the stories. So understanding a story, that is at the age of 2 years. Telling a story, that is at the age of 4 years. So answer here is in the favor of the 4 years. Moving on to the next question. Which of the following is not seen in cystic fibrosis? Right, at a broad spectrum we are saying which of the following is not seen in the cystic fibrosis. Cystic fibrosis, of course, meconium ileus, right? Because in the neonate what we can see is the meconium plug syndrome. We can get is the meconium plug syndrome. We can get is the meconium ileus, and we can get is the meconium peritonitis. Meconium peritonitis, right? So this particularly thing can be seen there, right? Coagulopathy. Coagulopathy can very well be seen. Why it can be seen? Because here there is fat malabsorption. That is one thing. So this fat malabsorption can result in vitamin K deficiency. And the second thing here is there is presence of the biliary cirrhosis. So due to the biliary cirrhosis, the liver is not functioning optimally. So there is suboptimal, right? So due to the suboptimum, coagulopathy can very well be seen, and due to the malabsorption, diarrhea can also be seen, right? So duodenal atresia, right? If it was a nasal polyps is definitely seen. Nasal polyps is definitely seen in the cystic fibrosis, right? So according to some students, because exact recall based questions are there, so there are many mistakes there. So duodenal atresia, or maybe it was the biliary atresia, whatever was given in the choice, that is the best answer here. This is not seen in the cystic fibrosis. Biliary cirrhosis is seen. The bile becomes thick, right? The bile becomes thick. But if you are particularly saying that there is diarrhea, coagulopathy, meconium ileus, all of the following things can definitely be seen in cystic fibrosis. Okay, Anuj. So going on to the next question. which of the following statement is not correct regarding the breast milk jaundice. Now before answering this question, let's read the exact line what is given in the textbook of Nelson regarding the breast milk jaundice. What it says: significant elevation in unconjugated bilirubin, breast milk jaundice develops in estimated 2% of breastfed term infants after the 7th day. With maximum concentration as high as 10 to 30 reached during the 2nd to the 3rd weeks. Right. So this is, I am not taking anything because the different statements are there, but if you want to answer a standard question, you should definitely have the standard lines. This is exactly what is written in the Nelson is there. So if you see here, if breastfeeding is continued, the bilirubin gradually decreases but may persist for 3 to 10 weeks at lower levels. Phototherapy may be of benefit, right? Then another thing, although very uncommon, the kernicterus can occur in patients with breast milk jaundice is there. So if we go to the points here, of course there is increase in unconjugated bilirubin. Phototherapy may be given, but always given? No. That is the important thing. Phototherapy may be given. Can it cause kernicterus? Although it was not in the choice, yes, it can definitely cause kernicterus is there. And the etiology, basically it is the enzyme beta glucuronidase which is present in the breast milk, which results in the increased enterohepatic circulation. So based on this, if we consider here what all are true here, increase in unconjugated bilirubin, absolutely right, that is there. Breastfeeding should be stopped? No, you do not stop the breastfeeding, you only reassure the parents. What you practically do is, all the so-called known causes of the increase in unconjugated bilirubin, we are able to exclude those causes, right? So if we are able to exclude those causes, still there is jaundice, then we think this might be the breast milk jaundice. Now if you see, out of this we have to choose one. Most need phototherapy or phototherapy is required. This is not true. We have just seen phototherapy may be of benefit, but mostly the breast milk jaundice child needs phototherapy. No, that is not true, right? So basically here the bilirubin is more than 10 in 3 to 4 weeks. So if it was a multiple answer type, then the better answer is B and C. If it was a single answer type, it is B more than C. Is there, right? So which of the following is not correct regarding the breast milk jaundice? Not correct here point is the B point, that most need phototherapy, and I have just shown you the exact language what is being given in the Nelson here. Going on to the next one now here. Out of the following, which is incorrect regarding biliary atresia? We are saying here, out of the following, which is incorrect regarding the biliary atresia, right? Now we again go to the points, and these points this time I have taken from the AIIMS textbook of the neonatology, AIIMS protocol of neonatology, latest edition. I am showing you the lines. What lines it says is, HIDA scan is of limited value in evaluating neonatal cholestasis, while an excretory scan rules out biliary atresia, but a non-excretory scan may also be seen in hepatocellular causes of cholestasis. So what does it mean practically is, this practically means that HIDA scan is of benefit but of limited benefit. It alone cannot diagnose biliary atresia. That is one thing we remember. Now if you see the second thing what they have written here, biliary atresia will require portoenterostomy, Kasai procedure, and if operated early, less than 60 days, this is exact what is written in the AIIMS protocol of neonatology. It has much better outcomes in terms of achieving biliary drainage as opposed to surgery at a later age. And they have clearly mentioned here, that is the 60 days. They have mentioned here is the 60 days is there, right? Two things are particularly which we are given here. So if we go to the choices here, what they have written here, Kasai surgery to be done before 3 months ideally speaking, ideal is it should be done before 2 months. Most common cause of cholestasis in India, definitely. HIDA scan is used for diagnosis. If that was the language, this is a correct statement. But if the language was HIDA scan will confirm the diagnosis, no, HIDA scan does not confirm the diagnosis. Liver biopsy definitely helps to differentiate from other causes, and if liver biopsy is not confirmatory, if the liver biopsy is not confirmatory, then you particularly go to the intraoperative cholangiogram. You particularly go to the intraoperative cholangiogram, right? So according to me, if the line was HIDA scan is used for diagnosis, yes, plus minus, but still we say HIDA scan is used. So out of this 4, the right answer should be the Kasai surgery to be done not before 3 months, to be done before 2 months. Then we go to the next one. Out of the following which does not correlate with the severe acute malnutrition. SAM is something a very, very important topic for the INICET exam as well as for the NEET exam. Yes, there is presence of edema, weight for height less than -3 standard deviation score, mid upper arm circumference less than 11.5. All 3 are the criteria. Height for age, right, we remember is a criteria of chronic malnutrition, that is stunting. That is stunting. If ever particularly you forget, you can simply remember the word HAS, has. Height for age is equal to stunting, and weight for age is a marker of both acute and chronic malnutrition. So if this were the particular choices given, out of these choices, this is what we say here: height for age or weight for age, whatever choice was given, that does not correlate with the severe acute malnutrition. So if a height for age Anuj was there, so definitely the answer here is height for age only. Height for age only, that is not a marker of the acute malnutrition. And always remember, when you say acute malnutrition, that means malnutrition is less than 3 months. That means malnutrition is how much? That is less than 3 months is there. A 3-year-old child who presented with diarrhea, hematuria, thrombocytopenia. Out of the following the most common causes. So if you particularly see, we are being talked of a cause of the hemolytic uremic syndrome. Hemolytic uremic syndrome, HUS. And HUS basically you get a triad, and that triad is a triad of thrombocytopenia. That is one triad. There is microangiopathic hemolytic anemia, and there is particularly presence of the renal failure. And the concept basically is there is a thrombus which is present in the small veins. So in the glomerulus or in the small blood vessels, and glomerulus is capillaries. So in the capillaries there is formation of thrombus. So if in the glomerulus there is formation of thrombus, blood is not filtered, and in the body urea level increases. Therefore this is named as the uremic syndrome. And out of this, the most common cause here is the E. coli O157H7. E. coli O157H7, which produces verotoxin. Verotoxin, again a straightforward question. If this was the simplest one, I think so. In severe acute malnutrition, to say primary treatment failure, which is true. Now first what you need to understand is what is the meaning of the word primary treatment failure and what do you mean by the secondary treatment failure. And this exactly is the line I have taken from the textbook of Paediatrics by O.P. Ghai, right? Primary failure means when you are treating the child in the hospital. And the secondary failure means when the child may be discharged or all the complications have gone, at that time you say is the secondary failure. So you please should remember the criteria of the primary failure. The primary failure is failure to respond is indicated by 2 days are important. One is day 4, one is day 10. Normally the child should regain appetite by day 4 and the edema should start losing by day 4. So appetite should be regained by day 4 and the edema should start decreasing by day 4. The edema should completely basically gone away, or there should be no edema by day 10. By day 10, and there is failure to gain at least 5 gram per kg per day by day 10. This is basically what we say is the primary failure. And the secondary failure is failure to gain at least 5 gram per kg per day for 3 consecutive days, right? It should be here for 3 consecutive days during the rehabilitation phase. So this is one is primary treatment failure, another is the secondary treatment failure in the malnourished child we are talking here. So if we go here particularly, what we say, edema present on day 10. Yes, this is a primary treatment failure. Not started to lose edema on day 4. This is also the thing is, right? Either way, this was a multi-answer type question, or the recall we have got that is not proper. But this is something to be remembered. Appetite not regained on day 4. Less than 5 gram per kg per day weight gain on day 10, right? Exactly, this also becomes right. Clear? That is what we mean by the primary treatment failure is there. So this is the question what I got, and I have basically given you the reference also, right? So there should be no confusion. I am giving the answers along with the reference so that everything should be clear, right? Okay, Nishant, Anuj, and this Sajagnath. Okay, now we go. NADA's criteria is used for the diagnosis of congenital heart disease. It includes all except, a repeated question of the AIMS exam. This is a PYQ type of a question, right? There's a major criteria, minor criteria, abnormal heart sound, that is S2. S2. Leah, the last choice was day 20 you are saying here. So I make it day 20. If it was day 20, then means this is not right, right? So this is also excluded. If it was day 20, it was day 20, it is excluded here. So we say here abnormal second heart sound, this is a minor criteria. Congestive heart failure, this is a major criteria. Abnormal chest x-ray, again a minor criteria. So what is not used here? Elevated troponin T. This elevated troponin is not included in the criteria of NADA's, which is used basically for the diagnosis here. So right, this is not we are using here. Most common cause of diarrhea and dehydration in a 2-year-old child is, again a very simple question, right? Again a very simple question. So what we say here, the answer should be rotavirus. Rotavirus is the most common cause of diarrhea, dehydration up to 2 years of age, and after 2 years it is the calcivirus. It is the calcivirus, and the rotavirus produces the enterotoxin. Do remember the name of the enterotoxin for the future exams. That is the non-structural protein 4. Non-structural protein 4. Right? Again a very simple question. So there is a dehydration, and that is the most common thing you get in the rotavirus, that there is dehydration. See. Which of the following is correct regarding the CPR in children? Cardiopulmonary resuscitation. Again we go to some of the lines what is being there written in the Nelson only. Start CPR. First rescuer performs cycles of 30 compressions and 2 breaths. So if it is a single person, it is 30:2. But if it is a second rescuer, it performs cycles of 15:2. So if there are 2, the ratio is 15:2. If it is a single person, the ratio is 30:2 is there, right? Then chest compressions. The chest compression should be provided at the rate of 100 to 120 compressions per minute. This is, we are talking of pediatrics now, child. We are not talking of neonate here, right? And the goal chest compression, the depth for infants and children is at least 1/3 of the antero-posterior diameter of the chest, which is approximately 4 centimeter in infants and 5 centimeter in children, right? So I've taken exactly the lines from the Nelson so that you can also be sure enough that we are giving to you the same answers here. So what is we are going to compress is, we are going to compress at least 1/3 of the antero-posterior diameter of the chest is there, right? That is there. Then regarding epinephrine, the dose is 0.1 ml per kg. 0.1 ml per kg, and it is given by intravenous and intraosseous route. Intravenous and intraosseous route. If that is not possible, you give by the endotracheal route. Endotracheal route is there, right? Exactly the languages. So now we go to the same question here. What we are saying here, chest compression, yes, absolutely right. The first line says this is true. Adenosine, no, we are giving is epinephrine. This is not true. Dose of adrenaline here given, that is not true. To rescuer ratio was particularly, that is 15. Anuj, if it was asked which is wrong, then it could have become the multiple answer type, right? I can agree, because you people have given the exam, you know the better things, but if this is thing, this might be there, but this is the right here. So we say here chest compression at least 1/3 of the anterior-posterior diameter. This is definitely and definitely the right here is clear. Going on to the, I have given the references also, so the things becomes easy. Again, a very simple question. It was asked the inheritance part of the disorders. Duchenne muscular dystrophy, definitely it is a X-linked recessive disorder only seen in the males. Cystic fibrosis, which is an autosomal recessive disorder, CFTR gene, chromosome number 7 is affected. Leber's optic atrophy, mitochondrial inheritance. Spinal and bulbar muscular atrophy, trinuclear repeats, that is CAG repeats. That is the CAG repeats is there, right? So this were there again a simple question was there. Most common cause of croup that everybody knows, parainfluenza virus, must have been discussed in the ENT part also. So this was the some of the questions which I could get from the students. And if you find any further questions, you please share with us also, right? This is there. You can share with me on the Telegram group. Already we are having many quizzes there in the Telegram group. They are all pinned quizzes. Whenever if you are preparing for NEET PG, be a part of this group. You are definitely going to help. And any queries you can ask me there also. Keep your finger crossed. Just pray to God. Everything will be good. If you have done good, everything will be good, right? That's all from our side. Dr. Ashutosh Aggarwal now says, wishing you all the very best for the result. I hope so, right? And if you are still preparing for the NEET PG, I am there always, right? Please and please be with us, right? Thank you so much. Thank you, Vibhor. Thank you, Anuj. Thank you all from DAMS Notes and TND. Thank you so much. Thank you, Leah, as usual. Your messages are always, particularly Anuj, all in DAMS Notes. Thank you so much. Thank you all. Right. So with this, I take a break now. See you all soon.